We're back on Open Line discussing a health and well-being survey of Nashville and Davidson County that has just come out with some interesting statistics. And again, my guests tonight, Samni, Areola, and Tracy Buck, both from the health department. We appreciate you being here tonight and talking about this. Before we went to break, we talked about the issue that this revealed among Latinos. Really, this is a baseline that we have now, but obviously when you see that more than 4 times as likely not to have health insurance than white or black, the white or black population in Nashville, that's concerning.
It is, and it then gives us the opportunity to go into the Hispanic community and try to address that. You know, how do we, work with the Hispanic and Latino population here in Nashville to get them signed up for insurance, making sure that their children have insurance access.
Is this strictly, sorry to interrupt you, is it strictly a language issue? Obviously there's a language barrier for many trying to find maybe a Spanish-speaking healthcare provider, or could it be fear? There's a lot going on with maybe some people are don't have documents or do, and they're just trying to kind of fly under the radar and work a job and raise their kids and I know that there are language barriers if you don't speak English, but there are insurance and health care is available in multiple languages. Sure.
There are 140 plus languages spoken in metro schools. So we have language resources in this community. A lot of times it really is that people don't know where to go to access it, or if they are undocumented, there is a fear factor of going to a governmental agency or going somewhere that they're going to be asking more questions. But if they have need, we are hopeful that they will reach out.
Yeah.
And I think that's part of our message is we have resources even within the health department. We have interpreters for multiple languages, mostly Spanish and Arabic. We are going to work with you if you need help. We have staff that will help people sign up for insurance. And we've had that for several years. So we have those resources there. In terms of this data, part of what we need to do, it will be easy to fix if the problem is really easy. So part of our job is to work with people that understand the community, that understand the Hispanic community.
Right, I was just going to ask, how do you then get the word out, and specifically in this case to the Latino community? How do you get into the community and educate and spread the word and really get out and let people know, look, these resources are available and we want to help? Well,
we actually have an opportunity, and I don't think I've had the opportunity to actually share this with Dr. Samni, but the health department is working with several organizations that provide services in the Hispanic community. I know Conexion, the Hispanic Family Foundation. There are a few others.
I'm sure.
Yes, but
Latino.
This group is looking specifically at building off of this work and the work that we did with the community health assessment last year to really talk to the Hispanic community about the needs within that community specifically, to really make sure that we have a firm understanding of where they see the problem, and then help them to get those services.
I should point out that Senator Frist did not mince his words after looking at this. He said, we as a city are much worse off than people think. And we can't sustain Nashville the way we are going. We have good health care here, but the health and well-being is miserable. And then it goes on to say some dramatic findings related to access to health care. In addition to the statistics about Latinos, and this is surprising. The survey revealed that residents who are gay, lesbian, or bisexual were nearly 4 times as likely to be uninsured than their straight peers. That's surprising.
It is.
Right, but it goes to, so the county health rankings that Robert Wood Johnson Foundation puts out. Last year, for 2018, we were ranked 6th in Tennessee. This year, we're ranked 11th. Now, you have to drill down into the region. So again, keep in mind, 11th out of 95 counties in a state that is 44 out of 50. So we have room to grow. And this is why the assessment like this is good. Everything that the senator pointed out is important. Is then for us is how do we bridge those gaps? We are now able to pinpoint those gaps, and it's not acceptable. It shouldn't be acceptable to anybody. And the impacted community, it's incumbent on us to make sure they are also at the table. One of the things we want to avoid is sit down and figure out what the problem of this community is, that community, and say these are your
without
solutions.
having any representation.
So we want to
Right.
engage them, and we're going to do that in multiple ways. They know the community, they know their norms, their values. We want to develop those interventions collaboratively with them. And Tracy said that earlier, there are resources in the community. We just need to channel those resources to the right place.
Affordability, we talk about this with the income gaps and whatnot. How do we address that? Just affordability. I mean, just talking with someone recently, you know, I was at an appointment and got some eye drop prescriptions, and even with insurance, just for a little bottle of eye drops, $100. And I'm thinking, okay, maybe I'm not going to get those eye drops. But, you know, it just goes to show, depending on what, you know, issue you have health-wise, there's a lot of people just don't do it. They just avoid their prescriptions. They avoid going to the doctor because they have to put their money elsewhere.
Right.
And obviously that just leads to worse problems for mental health, for physical health.
And that speaks to why we need to focus on prevention. Now, if you've already, you already have a disease process, we can't turn back time.
Right.
But for young people, for people who don't have the disease process, say you're 45 years old and you have a family history of diabetes and you have hypertension. Well, are you aware of what the risks are for your health in the very near future if you don't make some changes? A lot of people are not. People need to be aware of what their risk factors are.
The question is, why are they not aware?
That's
there's no one answer for that.
There's no one answer.
It is also true. I think you started out by talking about the cost and income level. Those things are huge. Of course, that's bigger than a city. That's in the United States, we have arguably the best health care in the world. But among the developed world, our health is pretty low.
Yeah.
But the difference between us and those countries is they make much more bigger investments in these social economic determinants where when people go through hard times, there are support for those things. Nashville, the past 5 years has changed.
Yeah.
Housing is impossible and so we can't. It's a bigger societal problem in terms of economics, in terms of how much people make, and I know that there's a lot of efforts ongoing, but those things are important. If I have to choose between my 3 square meals and paying $100 copay, I'm probably going to choose my meal.
Right.
But all of those factors impact health. Think about it. If I have to spend 2 hours on a bus to go to work and back, that's 2 hours that I don't have to relax, to play with my family, to do other things. So the consequences, the public health, physical, mental health consequences of poverty is big. Now we're having families, multiple families living together because they can't afford homes. And when we think about that, we think about affordable housing, but we don't think about their impact on health.
Right.
And that is the principal determinant. There's a lot of stresses on people.
So when we think about this, you know, as you tie this all together, it makes sense what you're saying. I mean, even, you know, like you said, sidewalks and public safety and affordable housing, which is a huge issue right now in Nashville. It's going to take a lot of people in a lot of different groups to sit down. I mean, this is going to be a big table if everyone's sitting around this table. I mean, and it's going to take time and patience and really a lot of leadership and focus, I would imagine.
Correct.
To
I think
start
you just saw
moving the needle.
A lot of leadership, a lot of people at the table. But it took us a lot to get to this level where we don't really like. It took us a lot to get to where certain zip codes don't have enough resources. It took us a while to get to to create food deserts in places. So, but we can also be intentional. One of the things we like to say in public health is Music City. That's Nashville. It took some level of intentionality to brand the city as Music City. So if we're going to create a culture of health and be not just each city, but be the most healthy city, we have to be intentional about that.
Yeah.
It is doable.
And what's ironic is as you look at this survey too on the back and you look at all of there's LifePoint Health, obviously HCA, I mean, we're United Healthcare. Nashville obviously is Music City, but the healthcare industry here is huge.
Sure, yes.
It's right in our backyard. We've got all these experts and executives and companies, and yet we look at the survey and we realize we're missing something here.
Correct.
So obviously to get these companies involved can help.
Yes. And
Important to have
very,
them.
very important. And I think an important next step in, you know, changing the way that we look at health and not just at the endpoint for health care, but really looking at health from a very holistic point of view and really starting to look at prevention and paying for prevention.
Police department, the sheriff's office, they need to be involved as well, because when we look at specific zip codes where crime rates are high, I would imagine that some of these statistics show up as well, where it's just poor health in general, right?
If every time I step out of my house, if what I hear are gunshots, I mean, I know Tracy leads our efforts on health promotion. She can tell me as many times as she wants for me to go walking. I won't, because I don't feel safe.
Right.
And so that's true. But we do work with police, fire, sheriff. We just need to increase the dose and the intensity, because those things, they do matter here.
All right, let's go to Lucy, one of our regulars. Hey, Lucy.
Hey there, y'all.
Thanks for calling in.
I'm probably going to be a little bit out of my lane as normal, but I was just listening to some of what you were saying. I'm familiar with the gentleman there. I think he works for the Department of Health. He's the head of the... Okay. All right. Well, let me give you an example. You talk about stress. About a year ago, I was getting out of my car, and there were two people sitting at the bus stop. And I was trying to pull some bags out and everything, and both of them were discussing how many times that week they had gotten mugged sitting at the bus stop, you know, trying to go to work. And this was in front of a McDonald's. Yeah. And I'm like, I can't imagine getting mugged twice, and then once this week and once last week and then 6 months ago, with riding the bus and working at McDonald's. So you're talking about stress. Yeah. When the Affordable Care Act came out, I thought the whole point of health care reform was the major emphasis was preventative care. They've talked about that for 30 years. But when you see how all that was rolled out, and now no information is being given to the public about what is what, a lot of people, especially on the low income and even people in the middle income, they don't understand how the Affordable Health Care Act works. What healthcare.gov is different than an insurance agent saying, yeah, I can get you some insurance at Farmers, but then you find out that you've got like a $12,000 deductible.
Yeah.
And the Affordable Care Act was supposed to cover people with pre-existing conditions, and I'm hearing from people who have pre-existing conditions, yeah, they'll insure you, but they won't treat the pre-existing. I'm like, hang on a second.
Right.
They would insure people 20 years ago with pre-existing. They just wouldn't cover those conditions. So supposedly under the Affordable Care Act through healthcare.gov, those pre-existing conditions are supposed to be treated. So I went to a seminar who I thought was the government workers or volunteers informing people on the rollout of Obamacare, and come to find out it was an insurance agent, because I couldn't figure out. I asked him, why is your sign across the street and not over here? Well, come to find out, he wasn't with the government. He was a private insurance guy that was almost kind of deluding people into thinking he was those workers. So all of this stuff has gone on. If they would have transparency in the pricing, which 40 years ago, if I called up the doctor and said, I need to come in, you didn't really have to have insurance. How much is the visit? I could come up with the money, come up with half of it, and get it paid, and not get shocked by something because I'm the public and I have no idea, because it's top secret, what a healthcare provider or an institution like a hospital negotiates with these insurance companies in between.
It's definitely a factor.
I just get the end result. So that's why nobody's figuring out. And what I want to talk really specifically about, you mentioned households. It's so hard. Everybody's moving in together. Well, when you get insurance under the Marketplace Affordable Care Act, everybody in that hospital is factored into your premium cost. So think about that. And think about, if you're here legally or illegally, how all those people are going to get figured in, and everybody's just like, I'd rather die.
Wow, Lucy, thank you so much. Obviously, we could go into a whole separate hour just on health care and coverage and the government's involvement and private insurance and all of that. Hold your thoughts. We'll think about Lucy's call. Thank you, Lucy. We appreciate it. We'll take another break, and we'll talk more about it on the other end.